Welcome to Amplify Family Medicine, the official podcast by the Alabama Academy of Family Physicians. In each episode, we dive into the challenges, triumphs, and innovative practices that shape family medicine across our state. Whether you are a medical professional, a student with an interest in family medicine, or simply a health-conscious listener, Amplify Family Medicine promises to provide invaluable insights and inspire action. Let's amplify the impact of family physicians in Alabama together.
Hi, everyone, and welcome to this episode of Amplify Family Medicine with the Alabama Academy of Family Physicians. My name is Kaitlyn Riggins, and I'm really excited to be here today. I'm joined by my co-host, Dr. Deloney, and together we'll be talking with Dr. Brittney Anderson about her journey in family medicine and opening her own practice. As I stated earlier, I'm Kaitlyn. I'm a second-year medical student at the Frederick P. Whitten College of Medicine. So, Dr. Deloney, could you tell us a little bit about yourself?
Hey everybody, I am Chelsey Deloney. I'm originally from Gardendale, Alabama. I'm a third year family medicine resident at St. Vincent's East in Birmingham, Alabama, and I did my medical school at UAB.
Awesome. I'll give y'all a little bit of a background on Dr. Anderson. She is an amazing family medicine physician. She's originally from Autauga County, Alabama. She completed her undergraduate studies at the Duke University. She participated in the Rural Medical Scholars Program in Tuscaloosa, and she went on to earn her medical degree at the University of Alabama in Birmingham. And she completed her residency training in Tuscaloosa at the Family Medicine Residency Program. She's been a leader within the Alabama Academy of Family Physicians, serving as the immediate past president, and she is currently the board chair. Since 2022, she's been in private practice in Demopolis, and she continues to serve her community there through family medicine. Thank you for coming, Dr. Anderson. It's going to be great talking with you. We're about to put you in the hot seat a little bit with some questions about starting a private practice. Is that cool?
Let's do it. You ask it, I'll answer it. Let's go.
Okay, amazing. Dr. Loney, I'll let you start us off.
Perfect. So our first question is, a lot of young doctors, they typically worry about balancing student debt with starting a business. So how did you approach your student loan repayment while also working to build your practice?
Yeah, so the first thing was just making a plan, right? So continuing that plan for financial awareness, which is important in medicine in general. We go from paying tuition, then all of a sudden you're getting an attending salary, whether you are employed or starting private practice. And it really is learning how to do a good job with managing your money. And so that certainly is something to think about. I encourage residents to, if you can, start paying some of your loans in residency. And even as you go out into your practice, whether you are employed or if you are going into private practice, to still be paying on those student loans regularly, right? But also to look for loan forgiveness programs that are out there. So I was really fortunate within the state of Alabama to be able to have loan forgiveness programs for a good bit of my training. And so that allowed me to take a little bit of the stress off, knowing that I wanted to practice in rural Alabama and then later to build a practice in rural Alabama. It really helped that my student loans weren't as high as I know some trainees can have during their training and right when they come out of residency. So, if there are opportunities that give you some type of loan repayment, that's one, and it's huge. Also, if you're going into a community, there are programs throughout the state, like the ARMSA program, that will give you additional funding to go into an area of need to practice. And so doing those things, but also realizing that, starting a private practice for sure and starting any kind of business, you're going to have some capital to get going. And so, having your own funds there, but also, there will come a time that you may have to take out other loans as well. So just really being smart, shopping around, making sure that you're getting the best interest rates possible, but really keep in mind that you've got to pay those student loans back too if they come. So just really budgeting well.
Perfect. Yes, I agree with that. That's something I'm going to keep in mind as I venture into residency and getting out of medical school and trying to go into practice. So thank you for those tips. That's amazing. I know a lot of young doctors worry about like balancing student debt and things like that. And a lot of people worry about making money going into practice or working for a hospital and things of the sort. So we wanted to know, opening your own practice, with doing that, have you discovered any other opportunities to generate income outside of direct patient care, such as through partnerships, consulting, other ventures, things of the sort?
Yeah, so there certainly are several other options out there. Some people do some moonlighting while they're working on starting their private practice. So while they're building their patient panel up, they've still got some income that's coming in. So whether they're doing some ER moonlighting or other types of things that they may do. I did a little bit of moonlighting before starting my practice, just again to make sure that I had some extra funds that were there that were saved up so that if on the off chance the practice didn't start off the way I wanted it to and I needed extra funding, then I would have that available. We were really fortunate and blessed to hit the ground running in our practice. I mean, we opened basically a full patient panel, and we were seeing patients from day one in the same way that we're seeing them now. And so, that just took really good marketing. So we marketed the practice like crazy, and really made sure that folks knew that the practice was here and that we were planning on taking really good care of patients, and it just took off like gangbusters. But for folks who are thinking about that or maybe concerned about that, just know, I mean, you've got a medical degree. When you've got a medical degree and you've got some good training behind you, you can make some money, right? And make some money if you need it to, or if you got yourself, a little bit behind. And moonlighting is kind of the best way. Maybe working some urgent cares, doing some ER, that kind of thing, if you need to kind of store up some funds while you're working on building a practice up. So those things are certainly out there.
Thank you for that. Could you touch on a little bit about what moonlighting is exactly? I know a lot of people hear that term, but they don't really know what exactly moonlighting is.
Yeah, so moonlighting is something that you can do as a resident later in your training after you have passed through boards and gone through the appropriate testing requirements. And it really depends on a lot, I think, your residency programs as well, right? And Chelsey, you back me up on this if I'm misspeaking, but your residency programs have to allow you to be able to moonlight in residency. And that generally is where it starts. So sometimes as a later year, third year resident in family medicine, you're able to pick up some extra shifts. And again, outside of your training hours. Now, you can't be moonlighting when you're supposed to be in the hospital or seeing patients for
Right,
residency, things like that.
right.
But it's a way to get some extra experience and also get some extra money. And I guess even as an attending physician, in my head, I still call it moonlighting because it's just doing anything outside of what is your regular, scheduled position. And so there are still, attending physicians, docs who are out in practice who quote unquote moonlight. So whether that's working in urgent cares on the weekends or working some ER on the weekends. So just moonlighting in general, to me at least, means doing something outside of what is your regular scheduled clinic requirement for just to make extra funds to increase your reach too. I mean, some docs will come to rural areas and moonlight because they want to be able to kind of give back and to help increase some of the access or decrease some of the access issues. And so all types of things that folks can do. Mhm.
Perfect. Thank you. Thank you for elaborating on that.
Yeah.
Yeah, and I haven't, that's my understanding of moonlighting as well, or that's how I think about it, which I've not started doing it yet, but I know a lot of us third years now that we're kind of getting into third year and hitting our stride a little bit more, a lot of us have plans to do that. So,
Yeah. I would
yeah.
encourage you. It's a great way to really put into action the things that you're learning, making sure that wherever you are, though, that you're going somewhere that you can get somebody on the phone if you need them, right, while you're still in your training, in case you need to call in and run something by someone. But again, just a really good way, as a resident to get some training, extra experience, I should say. And then as an attending physician, just a good way to again keep your skills sharp and to bring in some extra income.
Awesome.
Amazing.
And so, this kind of, so like my next question that we can kind of talk about, I'm also a rural medical scholar.
I
And
love
so,
that. Yes.
yeah, and so I love being in rural areas, would love to open my own practice one day. And so I know for me, the thought of that can be very overwhelming, not only just from how do you start this, but just financially, so in a financial capacity, how did you manage those costs in the early days? And were there strategies that you used to keep things kind of sustainable for your early practice?
Yeah, and I tell folks all the time, Chelsea, start lean, right? We sometimes dream about our dream practice and what we want our practice to look like. And I certainly encourage docs that when you're starting your practice, build a wonderful practice. But a wonderful practice doesn't mean you have to have golden chandeliers and things like that. So start lean. Think about the things that you need to do to be able to take good care of your patients, and to be able to feed your staff, right? And when you can do those things, then you can build a practice. And so budgeting from the beginning is really important. And so I talk with folks a lot about making sure that you make a good startup budget, that you include all the things you think you may need in your practice, and then you say, do I really need all of these things? And we minimize kind of some of those bells and whistles if you need to from the beginning. So that's what I mean when I say start lean. Just start with the things that you really need in order to be able to practice, but then have that wish list, right? That when we hit this revenue, or when we've exceed or paid off so much of our startup loan, et cetera, then we're going to buy this thing. And that will serve as a way to push you and motivate you as you go along. One thing I'll say too, and I mentioned this before, that there certainly is a place at times for taking out bank loans and things like that with the startup as well. With kind of that same thought that we had when we took out student loans in residency, right? Was that I plan on being a high earning physician and to be able to pay these things back. And I tell docs who are starting their private practice all the time that you can begin to think of it that way. Yes, you'll make enough money to hopefully be able to pay this back, but you have to put in the work on the other end, right? The difference in private practice and being in employed practice is that, you eat what you kill, right? And so you got to see patients in clinic in order to bring money in. And so it really does behoove docs who are starting their own practice to really make sure that they are doing the things in the right way so that they can get patients in the door. And so that means just taking good care of patients, being really involved in the community, especially when you're in a rural area. And so if your hope is to go back to a rural area, it's really to get involved in that community, to again market well and just make sure that you're taking good care of patients, and word of mouth really will do the rest.
Absolutely. And did you have any kind of extra tip? Like, what did you use to budget necessarily? Do you have like a software you keep up with, an Excel? Like, how do you manage that?
Yeah, so when I started off, it was just, spreadsheets. I love a good spreadsheet. That is probably my flaw in life, is that I'll put anything on a spreadsheet, right? So spreadsheets for sure. I use a lot of QuickBooks now. It's what our bookkeeper uses for our practice, and so everything stays there. But it really is, working with the bookkeeper. But I, even as the practice owner, it is one thing to have someone that I have contracted out to stay on top of our finances, but it is a whole other thing when I am the CEO, I am the owner of the business. And so, every day for the first couple minutes of a day, I take a quick look at it. And then on Thursdays are my administrative days. And so I take a really in-depth and detailed look at our finances just to make sure that everything is in order and it's how I want it to be. And so it really is just developing whatever system works better for you. But I do always encourage docs who are kind of new into practice around the time of practice that I am, even those that have been in practice longer or thinking about private practice, to really make sure that you're staying on top of your books and staying on top of the finances.
Awesome.
Yeah.
That is great advice. I love that you said that you kind of take into account, your books and things like that. You're not just allowing somebody else to.
Oh yeah, girl, that's how your money walks away.
It
When
is
you
how
make
your money walks away. I'm glad that you brought that up. That is so important to consider
Yeah.
going into private practice. As somebody who wants to open up a private practice myself, that is something that I always keep in the back of my mind, even though that's years down the road, that I need to be able to keep up with my books. So thank you for that advice, and thank you for putting
I
that out
heard
there for everybody to know.
I
Yeah.
heard a while ago Dr. Beverly Jordan, who we all know through the Alabama Academy as well, and I tried to give her credit, but she said she got it from someone else. But I heard her say once before I ever started my practice that if you mind your pennies, your dollars will take care of themselves, right? And so what that means is just really paying attention to kind of the little things, the things that will start to really add up, and making sure, again, that you are being mindful of your books and your finances, I think is so important. So I credit her for that, and I've got it written on my bulletin board, and it's one of the things I really make sure I stay on top of.
Perfect. Shout out to her for that because that is wonderful advice.
Gold.
So our next question kind of talks about like seeing a high volume of patients, which I know is something that is so important to do. And in rural Alabama, you do have a lot of patients that you see because you have a lot of people in the community who need care. So how do you manage your patient load while still maintaining quality personal care with each individual patient?
Yeah, so that's so important, and that's a really good question. Especially in an insurance-based practice, it is driven by the number of patients that you see. So unlike, direct primary care, which folks are doing, which I think is incredible, or some of these cash pay options or concierge options with insurance, it really is, it depends on you seeing volume. But it's not just the number of patients who come in. It also is important that we're doing, practicing value-based care. So it's one thing to see a patient, treat them, send them out the door. and be reimbursed for that. It's a whole other thing to see them, treat them, make sure that they're up to date with their preventive screening, if they've had their mammogram, their colon screening, all these things done so that you are in essence saving the quote unquote system money, right? Because then you're eligible for quality and bonuses and incentives and things like that for doing what we all as training and as current family docs are trained to do, right? Which is take care of patients and not, just the patient who's in front of us right now, but thinking about their overall health and preventive health as well. And so value-based care really does help an insurance-based practice continue to be sustainable. I see about 25 to 28 patients in a day, which is not a ton of patients. There are certainly docs who see many more patients than that. That is my sweet spot. My staff knows that if I have one more than 28 patients on my schedule, I'm probably going to lose my mind. And that is because just what you said, Kaitlyn, I love to talk. If you guys haven't been able to tell that already, I love to go in a room, sit down, talk with my patient. I use an AI scribe system that I love. And so I'm not, pecking on my computer while I'm there. It sits there, it's taking the notes for us. And so I'm giving my full attention to that patient in the room. We're talking about whatever their health needs are. And then we're talking about social things. We're talking about their families, what's going on in their lives, things going on in town on the weekends, all kinds of things. And I very much believe that developing a good relationship with patients, letting the patients know that you care about them as a person, not just a number that you've got to check off to say, I saw this many people a day, really helps to build relationship and build rapport. And so patients even start to make the visit more efficient, right? So they'll come in and they're like, Dr. Anderson, I'm here for this, this, and this today. And let's talk about this. And then I want to hear about your weekend. And so my patients sometimes will set the agenda for me as I walk in the room. But that's one of the things I love doing is kind of setting the stage when you walk in the room that this is what you told my nurses you were here for today, or this is what I want to discuss today. Let's discuss these things. And then let's talk about everything else you have going on. So that helps a lot. And my staff. So I have an absolutely incredible staff. They are so efficient. We huddle every morning, which is the most important thing we do in the morning. So every patient, unless there's a same day appointment or something, but every patient who's scheduled, we already know why they're coming in. We know what tests they need. We know what labs we're going to get. And certainly things change through the day. And sometimes something comes up in a visit and we've got to change that. But we work on efficiency and that allows us to be able to, allows me to not have to be in and out of a room in 5, 6, 7 minutes. I can sit in there for an extended period of time and talk to the patient because my nurse has already done the things that she needs to do on the front end. The phlebotomist already knows what labs we're pulling. Front desk receptionist already knows when their follow-up appointment is, and I've got AI Scribe doing my note for me. So we just really work on efficiency, and that's important, and that allows us in an insurance-based practice to really be able to see a good number of patients, but still provide really good care.
And I
Amazing.
think that's awesome. Yeah. And I think in family medicine, the relationships are so important. And that's the beauty and the fun. Even in residency, like you have high volume, high demand, but you
Uh-huh.
still get to make those relationships and follow people for 3 years. And that's always nice. But also in residency, you have high volume, high demand, and burnout is a really big thing. And they often tell you, like, hey, you need to stay on top of this. You need to have ways to cope, ways to handle this stuff. And I guess my other question for you is what strategies kind of have helped you avoid burnout while you've started your own practice and while you're currently running your own practice?
Yeah, I think that's such a good question. And burnout is real, right? And burnout for so many docs is why they leave employed practice and go to private practice. And so you want to make sure that you're not, leaving one situation that may make you burned out just to go to another situation and be burned out as well. But the beauty of private practice, I believe, is that you make it what you want it to be. I can easily say, you know what, 28 patients is too many in a day for me. For the next 3 weeks, I'm not going to see more than 20 patients in a day. Let's adjust our schedule and do things in a way so that I can, have better control of my schedule. Or we can say one of the things I really love about practice, my staff has a staff meeting every Wednesday. And every Wednesday we say, all right, what can we do to make this clinic better? And we can decide something on Wednesday at 12 o'clock at our staff meeting. And at 1 o'clock when the doors open again, we put that into place. And for me, so much, and I think for so many people, that's one of the things that leads to burnout in medicine, right? That you feel like you don't have that decision-making power. And so that's one of the things that private practice really gives you back. Um, I will be honest with you though, I've now gone from kind of quote unquote just being a physician to now being a physician and being the CEO, right? So I've gone from one job to now two jobs, two very big jobs and very important jobs. So it is learning to manage those things and to say, all right, I have my physician time and then I have my CEO time. And my CEO time means just what we talked about before. I need to be looking at my books. I need to be thinking about marketing. I need to be thinking about how we can grow and where we're going to be 3, 5, and 10 years from now. And so that allows me to be able to build a team that helps me to do better at those things. And again, that in my mind is just the beauty of private practice, that things that may have burned me out in employed practice or may burn someone out in employed practice, you can account for those things when it's your own deal. But burnout is real. I will say that forever. And, and it is important that we realize that and that we start to realize it early, that we don't wait until we get just to, bottom, but that whether you are employed or in private practice, that you recognize those signs and you do whatever it is that you need to get yourself help. Medicine will always be there. Patients will always be here. There will always be more patients, but there's only one of us. And if we, truly at our core want to do the best we can by patients, we can only do that by taking care of ourselves.
So true.
True. That is so true. And it sounds like you have it down packed. Efficiency is key. Efficiency is always key in making anything work. So whether that's school, residency, and a practice, it sounds like it's working amazingly. Like you were talking about earlier, it's important to have a team behind you too that can really help you go into this business or go into your day, go into your private practice and help you get everything flowing, get everything going so you can be the best physician and CEO that you can be. And so I know that you have figured all these things out, going on your path to being a CEO of your own private practice and being a physician in private practice. But looking back at all of the things that you've done previously, what do you wish you had known about the business and financial side of medicine before opening your own practice?
Yeah, so I did something before I opened my practice that I think was really, really important. And that is I grabbed together a group of family medicine docs who are in private practice already. And they may to this day not know that I grabbed them all together because I told you before that I love a good spreadsheet. So I made this huge spreadsheet. I came up with like 20 questions and I had maybe 10 or 12 docs who had just started private practice, had been in private practice for a while, or had been in private practice for a long time. And I asked them all the same questions. I asked them all the same questions. I asked them about their experience in private practice. And I really took to heart the things that they told me. And so that is one thing that I will never regret having done before starting my practice. It's still unfortunately not one of those things that they teach us as much in our training as we sometimes would want, so we don't get it as much in medical school. We don't get it as much in residency. And so if there's something that I wish I'd had before, it would be that. It would be having gotten it a little bit early before I handed in my letter of resignation and decided that I was going to do it. But thankfully, I had some wonderful, now friends and mentors who had done family medicine private practice, and they were able to walk me through it. But that's one of my hopes is really to be able to share with more students and residents and attending physicians kind of the joys of private practice, and not just the joys of it, but the fact that it actually really is possible, right? It's completely doable, something they can do. And so I've recently started a podcast that's called Physicians Hanging a Shingle, and it is all about, pulling back the curtain. These are the steps to opening a private practice. This is what I did. This is what you shouldn't do. This is what you should do. It worked really well for us. And it's been fun. I've had docs from all over the country who have reached out and commented on the podcast. And so I think in my own little way, I'm helping to make up a little bit for some of the things that maybe aren't taught in our training so that other docs and docs upcoming can know kind of the steps to doing it. And just to see, example in front of you that it can be done. It can be done well, and it can be really profitable and give you back the joy in practicing medicine.
That is so important. And I'm so glad that you talked about that because people going into private practice now, or people who are looking to go into private practice, as somebody who's a student, it's important to have somebody that you can look up to, a role model, or somebody that you can talk to ask questions. Because, like you said, a lot of the times it's not really taught in medical school how to open up a private practice because you're so busy learning how to be a great physician. And that's very important too. But it does help for people who do want to go into private practice to know, what do I need to do? How can I start? Especially people who have never done anything like business before. It's so important to be able to have somebody to talk to. So I'm so glad that you had that support system in order to help you to get to where you are today, and that you started something to give back to not only students, but residents or other physicians who want to get into opening up their own private practice. So that is amazing. And I'm sure many students like myself would love to thank you personally for doing that. That is great, and it's something that I look forward to being able to take some of your advice and to apply it when I go into practice as a physician. And so that's all we have for you today. We really appreciate you coming to talk with us and giving us such great advice while we put you in the hot seat. I know we had a bunch of questions that we threw at you, but we really, really appreciate it. And you had such great answers. And it's something that I'm sure all of us can take into our daily lives, planning a private practice or just planning to be a good physician overall. So thank you, Dr. Anderson, for your time. And thank you, Dr. Deloney, for being such a great co-host.
I enjoyed
Thank you.
it. You guys are great.
Thank you. Thank you for tuning in to this episode of Amplify Family Medicine. Have a great day.